Roanoke Chowan Community Health Center offers care management services for eligible patients. Hear from a couple of patients about what these entail.
My name is Margie Rankin Santos. I recently moved down here a couple of years ago to take care of my mom after my father passed away. My mother's doctor actually assigned us a case manager, and it's been one of the best things that could have happened to us because I feel like we have a professional in our pocket, someone on our team who can advocate for us. She knows the system. She's been able to coordinate transportation that we didn't know existed. So it's been quite beneficial.
Some of the care managers at RCCHC include Ellen Vaughn, Jonette Stokely, Victoria Harrell, Lisa Harrell, Kenesha Jackson, and Booker Daniel, who you will hear from shortly.
It's very hard to transport my mom, so having Booker come here has been a lifesaver. So I feel like I have someone who knows the ins and outs and, just a second set of eyes.
Excellent.
Miss Etta is 94 years old, and she's doing excellently. But she can't get around anymore, even with a walker. Her mobility is done. So one of their main problems was to get services to them. She really can't come into the office that much. And Medicare does not cover transportation to the doctor's office. But we were able, she had some needs, and we were able to work things out. So she goes to the wound clinic, which was what her major need was to begin with.
What would you tell someone the benefits are to having someone like Booker work with you?
Okay, you explain it.
That's great.
I don't know what we would do without someone like her.
Yeah, it gives us peace of mind. Someone else is looking out for,
And I like that they call us care managers instead of just case managers, because I just don't have a bunch of people that I manage their lives. I care about.
Yes, and you do.
Care management helps you identify your health goals and areas you would like to focus on to manage health problems. Your care manager will work with you to meet those health goals while assuring you get the best care possible from everyone involved in your care. As you make progress on your health goals, you gain better control over health problems, which can decrease emergency room visits, hospital stays, and extra visits to docs.
Hey, my name is Esther Parker, and I live in Murfreesboro, North Carolina. Wow. Care management to me is a group of people that actually care about your well-being. I had some health issues a couple of months ago with my heart, and when I got out of the hospital, I really didn't know which way to go or what to do. But once care management found out about my condition, they were right there to help me and to give me good advice, to help me to stay healthy and do what I needed to do. My case manager, Miss Monica, she calls me on a regular basis to make sure that I'm doing okay, to make sure that if I need anything, just my overall well-being, and they have been such a great help. When I first came home out of the hospital and I had medication, I had no idea how I was going to be able to pay for my medication because my medication was very, very expensive. I had one medication that was $500 a bottle, and I did not know. I was actually afraid that I would not be able to afford it, but they put me on the right track. They told me who I needed to go talk to here at RCCHC, and I went and I talked to them, and by the grace and mercy of God, I get my medicine at a much cheaper rate, and it's a big load off my shoulders. That much I don't have to worry about. Miss Monica calls me on a regular basis, and she wants to know how am I doing. has anything changed? Have I been to the doctors? Maybe what the doctor has told me. And just like I said, her overall concern about me. And I haven't had, I know doctors can't do it because they're busy. But with care management, they are never too busy, and I have her number, her personal number, and I can call her if I need her for anything. I've just been so overwhelmed by everything that I have needed, from medication to exercise program to just like you said, making sure that I have transportation if I need it, if I have enough food, if I need anything. All I have to do, not to say that every need will be met, but at least I know that there's somebody out there that is concerned enough and will put forth an effort because they're there.
To learn more about care management at RCCHC, ask your RCCHC provider or visit our website at rcchc.org.